name's Alison Shelley. I'm the Director of Human Resources and Organisational Development for Hertfordshire Community NHS Trust. Personally, I'd been with the Trust for about 2 years, so it was a really good time for me to go out and actively seek some feedback about myself, about my leadership style, about how I was perceived by my team, by my peers, by people outside of the organisation. So it was very timely in that respect. It was also using a very comprehensive model. In terms of the group session, I think what was most valuable for us was the fact that it was the opportunity for somebody externally as well to help us receive that information, think through that feedback. What is it telling us? What is it telling us about how we work together, about our interaction, about our dynamic? What is it telling us about our strengths and about our weaknesses, and how can we use that? Think about that in the other ways that we operate as a board and as a team. Pretty hard on the heels of that, we actually agreed to come together for a 2-day session. The difference there was it wasn't a half day or a 1-day business organisationally focused. It was actually more about spending some time together. And I don't think we would have done that in the same way if we hadn't had an initial feedback opportunity. With using this tool for the first time as the HR director, obviously I played a particular role in that, so I think it was absolutely about working in partnership. So yes, we chose to do that as a board. It was inspired by our chair. I was obviously very motivated and excited to do something different in this way, something innovative, something that had not been done before, but actually it was invaluable to be working in partnership with, for example, Health Education East of England. They brought a different perspective. They were able to facilitate some of the pulling together of this piece of work. So our organisation, our trust, is using the leadership model throughout the organisation. So it's a tool that we absolutely advocate. Certain leadership programmes that we run, we always advocate that the participants use 360-degree feedback and use the tool. So and we do that at various levels, various programmes, various development interventions that we do. People can use it standalone, so we use it in many different ways. So I think the power of us doing it as a board is that we're actually using the very same tool with the same assessment process, with the same questions, the same language, all of those things that other staff were using it through the organisation. So first of all, it gave us that consistency. It also meant that as a board we were doing the things that we advocated. We were actually walking the talk, so to speak. So I would recommend that people do use the healthcare leadership model, both individually or collectively, as a team, as an executive team, as particularly as a board. I think there is so much to be gained from it individually in terms of feedback, but also collectively. It's the opportunity to have a shared experience. It's the opportunity to get some feedback collectively that you can then use to underpin your conversations, your dialogue, your development going forward. And I think it also gave us the courage to say we'll do something like this again. So our chair, I know, is committed and has already talked to me about, well, when are we going to do it again, Alison? So I think that probably sums it up.